Who's on first?
Councillor Knack is on.
Today's Emergency Advisory Committee meeting brought to you by our friends at Skrillex. Somebody's calendar is on the screen there. I'm not sure.
Yes. Thank you, Mr. Mayor. And sorry, was it Dr. Zach?
Let's recess for a minute here before we remix this committee meeting. Just pause, please.
And if I could just ask anyone who isn't speaking to mute their connection, that might help solve things. Thank you.
Okay, stand by.
Point of privilege, I found that dropping the bass helps things continue.
Shut up.
Okay, we're going to try again. We'll have Councillor Knack. Just a reminder to everybody who's not speaking, if you can mute yourself just to isolate wherever the feedback's coming from. But we'll try this again. Councillor Knack, go ahead.
Thank you, Mr. Mayor. And just to clarify, was it Dr. Zachary we have from?
That is correct.
Thank you. Dr. Zachary, one of the questions I'm curious about, I believe I've been seeing information that suggests one of the challenges we're facing is that we don't know the original source of a lot of cases. I want to confirm it. Is that correct? Is that an accurate statement that I've heard? I don't know if you're muted or if I'm missing something. Maybe I will go on until we see it. Oh, hello? There we are. Hi.
Hi. Can you hear me now?
Yes, please.
Okay, sorry, I was on mute. So, in terms of the original source of cases, so I want to put a little bit of context on the contact tracing process where basically contact tracers connect with individuals who are deemed COVID positive status and then gather information about activities, potential contacts, etc. So it all depends on the history being taken. This is the typical way for getting information. As per the medical history taking processes, it might not be 100% perfect, but this is a way that is being adopted as a measure for understanding the nature of transmission and the sources. However, as just mentioned, the increase in the cases and the transmission sources have been lately attributed to private gatherings and household contacts of positive cases. So these are the main two drivers for infection spread among our communities.
What's the percentage where we don't know the original source on average? What are we finding?
Well, I don't have this number off the tip of my fingers at the moment, but we can definitely have a conversation with our surveillance team to get this number ready.
Okay, thank you. Maybe to administration, one of the things that was troubling, not from you, but just the information that you shared with us, was that you currently don't have any information provided around the epidemiology measures that would be used to inform either the repeal of existing restrictions or the enhancement or additions of new restrictions. Can you share, because I imagine you've probably asked for that. What are you hearing as to why we don't have that? Because that feels like a pretty major gap 8 months into a pandemic. And again, I'm not faulting you for this. I just want to figure out why we don't know that.
Councillors, some of the information that we've had is that as we've moved through the open watch and into the enhanced status, and certainly there were some thresholds established, that there are a number of different variables that are being considered. And so while administratively we've asked Dr. Zachary and Dr. Sikora and even Dr. Henshaw, what the next threshold will be, they're a little bit hesitant for a number of, good reasons, that there's so many things to consider relative to not just active case numbers, ICU, hospitals, but also other factors in epidemiology and outbreaks, that it's a bit hard for them to give a specific number that would be the trigger for the next level of restrictions. And again,
absolutely. And maybe that's fair, but you've even done work that has, without having that medical expertise, of trying to identify a series of measures that we would use to help inform our own decisions as a city. So it feels like if we've been able to do that, with the help of our medical experts, and I don't even want to suggest that this is an issue with Alberta Health or Alberta Health Services. I'm just trying to figure out why what's missing from this puzzle, because it feels like the lack of information makes it very challenging for us to plan as a province, as a city, and to be able to respond in an adequate way right now.
So I would like to highlight that we meet with our City of Edmonton partners 3 times a week with our surveillance team. Our surveillance team provide a timely update on the number of cases and the major drivers of the cases within the zone and within the city. We open up for questions and answers and discussions from various HS teams. Dr. Henshaw attends these meetings once a week every Wednesday to answer and address some of the questions that are being raised from a provincial perspective. So information is being shared. That's what I want to highlight and emphasize. Typically, there are some gaps in the information, and we do work around this, and we know that it's imperfect information, but we provide recommendations and for public health actions as deemed appropriate based on the available information that we have. And according to the information that we have from our surveillance team at AHS, as well as Alberta Health, where AHS surveillance teams with AHS and Alberta Health, they work together to ensure accuracy and consistency of data. What we have is the major driver of transmission is the social gatherings and having close contact at home with positive cases. For example, if someone is deemed positive at a household of 6 or 7, what we noticed during our work with our surveillance team, as with contact tracers, is that we would find almost, and in many instances, the whole household would become positive, and this is another major driver.
Thank you. I'm really out of time, so I'll come back. Thank you.
Thank you. Councillor McKean?
Thank you. Good morning, Adam. Wanted to first off say that I just recognized this morning how difficult this has all been for city administration, city staff. And I just wondered, is there a system you've established where you're checking in with each other, supporting each other? I suspect there is, but I just wanted to hear how you're maintaining your own morale at ELT, and then as that trickles down, how you're looking after each other during an extremely difficult time with COVID and budget pressures.
Well, thanks, Councillor McKean. I appreciate those comments. ELT checks in on a regular basis. Mr. Aiken does a tremendous job of checking in with the task team, and then we also have systems in place within the organization to ensure that folks, if they do need to talk to someone and get some support, John Dowds and the support system is there for them. So I'd just say that phenomenal team, phenomenal work, and we're there for each other. So thanks for asking.
Yeah, no, I think it's really good to hear. And I hope everyone knows that how deeply we appreciate the work under extreme stress. I was at the DBA meeting this morning and really pleased to hear about these weekly meetings you're holding, and would offer that I would be happy to attend those as a support, not as a critic, but as a support. Can you say how the social disorder situation is downtown, whether or not with the opening of that, we've seen a reduction?
If our EPS colleagues are on the call, they may have better intel than I do, and Mr. Smythe is on the call as well. So I just call on any of them to see if they've got any data to support that.
Councillor McKean, it's Rob here. We are working with EPS. Our responsibility is largely outside the building, so right. The operators are responsible inside the building. Initially, there certainly was an increase in incidences, if you will. So, for example, the amount of graffiti did increase, and there have been a few other incidences of broken glass and so on. But I think we were able to respond quite quickly. In that example, our graffiti team has up their game and is being very proactive and patrolling that area more than they would otherwise. So I think it kind of escalated to a degree initially, but I think we're at a point where it has improved. But it's an ongoing body of work, as you're well aware. We got to stay on top of it. And between our peace officers and the work that they're doing with EPS, there's a lot of activity. But I think it is all hands on deck. But again, it's not a one and done kind of situation. Maybe our EPS colleagues could weigh in as well.
Sorry, we'll see if we can get them on the call.
I might take another round anyways, but Mr. Smythe, it's a work in progress. You're learning as you go, I would expect to.
It is. And one of our emerging bodies of work is doing the Good Neighbor Plan and the community outreach plan. So we have a pretty strong plan, we believe, that brings it all together. That we are beginning to share with the DBA, and again, it's a work in progress too. But it does provide what I see as a pretty solid plan to coordinate our activities. Things like the vernacular, there's more challenges there. Historically we've had some challenges there. So again, it can be a bit of a hot spot. So again, just make sure that it gets scoped into the patrols that are down there. There is a bus service that we're providing, or the agencies are providing, to bring folks from Jasper Avenue down to the front entrance where the shelter is operating, to try to, so the congregation issue, can be a factor. The folks, when we met with DBA, there were some issues raised with some of the individuals who are staying there, and for their own safety in traffic, and be cautious of that. So we're trying to work on those kinds of issues. So again, it's an ongoing body of work. At this point in time, fingers crossed, we are trying to address those issues as they come up.
Thanks, Rob. Mr. Mayor, I'll probably come around again. Thank you.
Thank you. Councillor Walters. Oh, pardon me, Councillor Henderson is next.
First, and thanks, and Mr. Laughlin, I had a chance to say this to you personally, but congratulations on how well and how peacefully and with respect that camps were rolled down. I think that's a credit to the way you handled it, and I know we feared something different. But I do have one question about that, though, because my understanding, I think we've been pretty good about keeping an eye on it after the fact and keeping somebody down there, but I understand yesterday, and I don't want to go into a lot of detail, there was an event down there and we weren't around. So I'm just wondering about the kind of ongoing eye we have on the camp, even if I know we're in there cleaning it up a lot of times, but in those times when we don't, are we keeping an eye on it at 24 hours or how are we handling that?
Councillor Rob here again. No, we're not able to do it 24/7, but our peace officers' headquarters is just adjacent to the camp, basically. So it isn't far away at all. So those officers in their routing do strongly much more presence around the site, but it's certainly not. There's no one stationed there all the time. But we certainly are, have a lot more presence there, and we'll monitor it. And with the fencing up, that's obviously a deterrent, and that'll be up for the foreseeable future. But I wasn't aware of the issue last night or yesterday. But there's still, a lot of material down there that some individuals may think it has some value and may want to secure for their own use. So we can take that back and follow up, certainly, Councillor.
I don't want to make a big deal out of it, but I just, because I was impressed actually that we did seem to have people in there keeping an eye on it, and then I was surprised when I heard that we hadn't been around when this one.
Yeah, we'll go back.
Yeah. I'm curious, and you may not be able to say anything right now, but I'm interested, understanding that our situation may be different in the cities from what's happening in the rest of the province, and that creates complexity for the province. I'm interested what levers we feel we have that we can use locally, understanding that I think there's a good chance we're going to have to up the game on this rather than pull back. So, and if it feels inappropriate to share that now, that's fine. But I don't know what levers we actually have that could be useful in terms of trying to reverse the current trend.
Well, as I mentioned, we've sort of started the process of, if we needed to supplement within the municipality and again, trying to do that regionally and learning from Calgary. And we've got the U of A and in Calgary, they've got the U of C supporting in their sort of task teams as well. So it's really looking at the data and understanding that we've got some challenges in terms of getting the complete set of data, but using the data to potentially take some measures that we took early on in this process when we took what I think was a pretty aggressive step on some private businesses and some certain actions. And so I think we're looking at that, but Mr. Aiken is kind of just started, he and team have just started looking at that. So it's pretty early to say exactly what those are. And yes, if we wanted to get maybe into some specifics, that might be one of those in private conversations that we have, just so that we don't create a concern in community in terms of what we're considering.
No, fair enough. How much, and again, in looking at the data, and I don't know if anybody can answer this question, that may be part of the problem, is I suspect some of the things that we could do aren't necessarily going to be able to deal with where most of the transmission is happening from. And that's very different from the scenario we were looking at in March. That even the tools we used in March probably wouldn't have dealt with the issues we're seeing right now in terms of very familiar transmission. So do we need to be looking at a different set of tools this time?
Councillor Henderson, I think you're absolutely right. I think we not only have to look at our existing tools, different tools, and the different levers because the situation has changed. And I think that's part of exploring what those different themes and business lines and things at our disposal that we can bring to bear. And so that'll be part of the process that we're looking at right now, that, do we have those tools? What tools do we need to invoke to get us where we need to be, and what levers do we need to pull? So that is part of the work that I'm undertaking at the moment.
Great, thank you very much. I'm out of time.
Mr. Mayor, before we go to the next councillor, can we just do a test and see if we've got EPS on the call and we can hear them?
Sure.
Any EPS members, if you could *6 and just let us know you're there.
DC Brzezinski was on the call earlier. Can you hear us?
Can you hear me now?
Yes, we can.
Yes, we can. Great. Thank you.
Very good. Yeah. I can provide, we heard your question from before from Councillor McKean in relation to the convention center. We've recorded 43 events between November 5th and 12th. So we are responding to a number of calls there.
Thanks. Councillor Walters is next.
Thanks, Mr. Mayor. And I'm going to have a hard time not asking political questions today, but I'll do my best. So Adam, you talked about there's more that we can do in our jurisdiction, but what I heard from Councillor Henderson, if you're going to muse about those, we should do that in private.
Well, we're looking at what we could do, what more we could do, and right. It's early days in that. And before we've done the work, if you want an appreciation of maybe what are the things that we're looking at, I just would want to be cautious because we haven't really done enough analysis.
I understand it, and I think part of that, or whatever that is, needs to be underpinned by the data that we're getting from the province, right?
That's correct.
Right, and so again, not trying to delve too much into politics, but I haven't, as a councillor, as a citizen, seen a lot of the data like we did in the early part of the pandemic, where we showed the models and where we were trending, and if we did A, we'd get here, and if we did A++, we, you know what I mean? There was modeling that showed us a pathway to success. I haven't seen that publicly. Have you had any eyes on that privately?
No, I don't believe so. I'll just check with David. No, we haven't. We still do. Our dashboard is still there. That's not the model, but that's the data. Yeah.
Right. Dr. Zachary, it seems like the amount of the pie being occupied by the unknown sources piece is growing more and more all the time. Is that primarily because, could that be attributed to the lack of capacity for contact tracing in our communities?
Thank you for the question. So I wouldn't stress on the fact that like the original source kind of lack of full information, because we do have yes, as I mentioned, there are some imperfect information, and this is inherently within the process generally, not necessarily within a special setting. This is inherent because of the nature of the process, and this could exist everywhere. I wouldn't stress on the fact that lack of some original sources or unknown sources of transmission could be, attributing to the issue at the moment.
But
as I mentioned,
sorry to interrupt. It seems like the number of cases with unknown sources is growing, which is worrisome.
I don't have data to say that the number of cases of unknown origin is growing.
I guess just
that's not what we have from our surveillance data. There are some imperfections in the information, but all what we have from our surveillance data that the growing number again relates to private settings, private gatherings, and household contacts of positive case.
Well, we'll come back to that data because I'm not trying to be argumentative. I've just seen multiple reports that total number is growing. But if we can get that precise data, that would be very helpful. So thank you for that. But hypothetically, if it was growing, the lack of contact tracing probably would be a culprit if it was in fact growing.
So definitely for the first part of the question, definitely we will be working with our surveillance team to get this data being available. The second part of the question, yes, we do have capacity issues with our contact tracing team.
Okay.
And at AHS, senior medical officer of health level and executive director and managers for communicable disease team, they are working diligently to try to address this capacity issues and to work on streamlining processes to get the contact tracing pieces done. Also, the capacity issues, as we all know, had led to having change or temporary change in the contact tracing processes, where AHS would connect with the major priority settings with respect to contact tracing. And then with our contact tracing team at the moment are also working with the other settings to give more information around how to be able to keep contact lists with potential close contacts, how to be able to contact trace within the community until this issue being resolved.
Dr. Zachary, I'm well out of time, so I'll just come back on a second round, Mr. Mayor. Sorry to interrupt you, but I didn't want to go too far over. Thank you.
No problem. Thank you so much.
Councillor Essinger?
Thank you. And we've heard that schools have closed because, they've had a number of staff that have been impacted. And we heard that there's a number of healthcare workers that are off being quarantined. So I'm wondering if any of our lines of service are being impacted by large numbers being quarantined.
No, not that I'm aware of, Councillor Essinger.
I just worry as the numbers go up, we could be impacted, whether it was transit operators or firefighters, because we're out in the community. So it's something I was worried about.
Yeah, and we're still monitoring, obviously still monitoring the number of cases and for our employees and like what's happening in the city. The cases are going up, but it's not creating an impact on operations at this point.
Okay, so we are watching that and appreciate that. And the other area that concerns me is we see through the pandemic, we saw the impact on the vulnerable and the homelessness. We know that domestic violence has gone up and the severity of those cases are going up. And I guess I am worried as we go into Christmas, when often those times are greater impact. Do we feel we have enough resources going forward to support those folks?
Councillor, our domestic abuse high-risk team of social workers is certainly in place. And you're absolutely correct. They are seeing an increase on that file in general. Obviously, the work that they're doing with EPS. So they are trying to do best efforts, obviously, in terms of addressing that issue. And it's certainly on their radar screen, knowing that the holiday season is coming, and the challenges that flows. So they are certainly well aware of the issues that you're raising. So again, it is a challenging period of time, obviously. And I know the EPS are well involved in that area as well. I don't know if they want to weigh in, Deputy Chief.
You bet. We've seen a 16% increase from the three-year average in relation to domestic violence, but we certainly are continuing on with outreach and support of our victims and working with the registered social workers as well. So that's definitely on our list, and keeping in mind that with the holiday season, we are concerned as well.
Is it true that the severity is going up in some cases?
Yes, so that's one thing that we certainly noticed with COVID is that the severity of domestic violence had increased from our previous years. And again, we have dealt with many offenders and victims during this period.
It's a challenging time, and you can just feel in different areas where that anger or hopelessness is impacting how people treat staff and how they treat one another. And I'm wondering, I think we talked about a new communication strategy. We know that physical activity helps sometimes. Are we going to talk in that communication strategy where people can go outside, what they can do, what's available to them? Is there water or ice drinks that are open?
Rob or Katrin?
Yes, I can jump in, and then Katrin can follow up.
Sure.
Certainly, we have put a full court press on ensuring that all the winter activity venues, tobogganing, skating, cross-country skiing, are all a go for this winter, and getting the word out. Certainly, there's initial communication on our website. Our community rec facility branch are getting the word out through their venues. But I'll turn over to Katrin to continue.
Just to add that outdoor recreation communications is underway, and we will layer it into all of our messaging around being safe, and also making healthy choices to head outside.
Thank you. My time's up.
Thank you. Councillor Hamilton.
Hi. A lot of really good questions this morning from my colleagues. I think it was last week, the province came down with some guidelines with respect to group activities and group fitness. And I think we've all received some inquiries about perceived discrepancies between how those group activities were classified. For instance, swim coaching not allowed, but there's still figure skating or ice sheets being rented. And yet, like, another county adjacent to us is no longer permitting ice sheets to be rented. So I was wondering if you could provide some clarity on how the city, this is to city administration, determined what constituted group fitness or group classes.
So when those regulations and guidelines came down, that they were presented to us at meetings with Alberta Health Services and the ZEOC team, and they provided clarification, and we did our best to, with our law branch's support, interpret those. And so what we have found that there is a bit of a discrepancy between the interpretations with with ourselves and our regional partners, with everybody having a slightly different view on what those rules and regulations are. So we've identified that as an issue, and so as part of that, we were regularly sharing information with all of the regional CAOs, but also working with all of the rec directors within the different municipalities to get on the sort of the same line, and also seek additional guidance from the province about interpretation of those where we have a misalignment between different cities.
Okay, that's helpful. Is it so? You're basically saying that this is pretty fast moving right now, and you had to make decisions, and that some of those decisions might be revisited either locally or regionally?
That's absolutely correct. The decisions we made going into the Friday for the weekend were looked at and reviewed again the following week. With Dr. Henshaw actually shared some unique interpretations of the guidelines, which were offside. And so again, I think it's a learning piece and a development piece, but hopefully sooner than later that we will get all in line with what the guidelines' intentions were, and that we follow them.
Great, thank you. That was my question for today. Thank you all for your hard work.
I would just add, if I could, Councillor Hamilton.
Sure.
Every Friday morning, we meet with the regional CAOs to try and create that consistency and cohesion within the region around interpretation of guidelines and applications. So, but as Mr. Aiken said, fast moving and just challenging to try and do that at the pace that we're moving at.
I understand that. Thank you very much, Mr. Loughlin.
Thank you. Councillor Zadick is next.
Thank you very much. I think most of my questions will be for Dr. Zachary. So the good news that we're hearing about is that the province has ordered 680,000 vaccines for COVID-19. I'm wondering, what's the distribution plan? Do we need more than that? Just some thoughts around that. And then also this, we're talking about, it's going to probably be significantly into the year 2021 before we open up again. But would the vaccine not accelerate that? And with the effective rates of sort of 90% and 94.5% of the two competing ones, is that good enough? I just want some clarity straight from the source of Alberta Health on this one.
Thank you so much. So in terms of the vaccine distribution and efficacy and effectiveness, that's an Alberta Health question, and I can bring this up to our colleagues in Alberta Health who are closely working on that process of vaccine work and potential planning around this.
Do you have any, so I understand that this is not your specific area, but this is one of our opportunities to ask these questions. Just any thoughts on the distribution plan? Like, does that go to the most vulnerable people first, or is it spread across geographically, or is it first serve? Any idea with that?
At the moment, we didn't get information from Alberta Health with that respect.
Okay. So
Alberta Health, they're working on that portfolio.
Councillor Zadick, at a town hall last night, that question did come up, and Dr. Hinshaw identified that a likely approach would be healthcare professionals first, and then a sequence following that. And again, it just depends on the numbers and when those vaccines would arrive.
Okay, thanks, Adam. And actually, my next question will be for you. And I think a few of my questions, I was going to save these for the discussion tomorrow when we talk about the bylaw on masks, but I'll maybe get some of them out of the way right now, just quickly. Can you provide clarity on stores denying entry to people that say they're exempt under our bylaw, denying entry to people not wearing non-medical face coverings?
Yeah, wow.
Sorry, Councillor Zadick, it's Ms. Andrzejczyk. So right now, businesses can control access to their businesses on the basis of whether or not there are masks. So we don't do that. And we allow them to not only set those parameters, but to decide if they would allow an exemption if it's safe. They should be complying with any of the Alberta Health guidelines within their public spaces. Does that answer your question?
Okay. It does. I'll just ask another one. We were hearing a lot about charter rights and sort of, you can answer more in a yes or no kind of fashion, or if you want to elaborate, go ahead. But speakers that we heard were saying that it violates their charter rights to be wearing these masks. So I assume we would have done our due diligence on that. Can you just comment, please?
Yes, we have. This issue has come up in a number of jurisdictions, and as you will recall, we have to look, globally at the rights of everyone and ensuring the wellness and safety of all. So we are quite comfortable that we are fine with taking this approach that we have.
Okay, thank you. And
just
I have one
before
more
you,
question
just
that's
before
probably
you
back
go
to
any,
Dr. Zachary,
just
and then
before
I
you
won't
go any
probably
further,
back.
Councillor, just before you go any further, I'm just wondering, Councillor Nichol, could you mute your phone? Okay, thanks. Carry on, Councillor Zadig. I'll give you some extra time.
Mr. Mayor. One more question for Dr. Zachary, and then I probably, for what it's worth, won't need to ask any questions tomorrow in council, but we heard a lot about people wearing face coverings, that there's carbon dioxide attracted, it's causing skin irritation, and there's other complications and irritants from wearing masks. But I note that nurses and doctors often wear similar masks for a whole career. Is it common for people that wear masks day in and day out and have been doing so for decades to have the type of complications that we've been hearing about? And I to the doctor, I know you weren't in our committee discussion, but basically it's what I described, people talking about rashes and trouble breathing and all that stuff. So is that common in the medical community?
Well, thank you so much for the question. So complications could happen, or side effects, I would say. However, I'm not sure about how often it is, but what we have in terms of information that any intervention, we weigh the effectiveness versus side effects. And as we know, based on the evidence that we have, masks are effective. And even if there is some side effects that could happen to some individuals, this could be mitigated and could be worked upon on a case-by-case basis, because the majority that we have is that it is effective and with the least minimal side effects possible.
Okay, thank you. No more questions.
Thank you. Before we go to the second round, Mr. Zachary, Dr. Zachary, pardon me, couple of questions. So in the reporting on case origin, travel is one of the origin points still that is being tracked. Could you just break down for me, is that interprovincial travel or international travel, or would that capture interregional travel within, say someone who went to Calgary, returned to Edmonton, but acquired it in Calgary, or vice versa? Or would that be considered community transmission within the Alberta context if the tracing was that it was picked up on a trip but within the province?
Can you hear me?
Yes.
Yeah, thank you. So when contact tracing takes place, definitely all these elements that you just mentioned are taken into account. So any regional travel, like for example to other zone within Alberta, and we make sure that the pertinent healthcare professionals or public health professionals, MOHs and other pertinent teams are aware within that region, and the investigation carries on. Interprovincial, yes, and Alberta Health, we do have a notification system for Alberta Health to be able to notify the other provincial counterparts. Also, international travels are being taken into consideration and are being held. We report to Alberta Health, who report to Public Health Agency of Canada, and the investigation takes place as per protocol.
But if someone from, I just want to understand what's travel and what's not. If someone from Thorsby within the Edmonton zone acquires it in Edmonton, according to the tracing at their job, that would not be considered travel, even though there's intermunicipal movement. It's within the region and within the zone, so that would be considered community transmission if it can be traced?
I would say yes. We typically consider travel from, we don't have a specific definition to say travel, but we do track the regional, we do work with our regional colleagues to be able to track possibility of transmission, and we carry on the investigation based on that, regardless whether it's within the same region or within other regions. It would be considered as a community transmission either way, especially if it's within the zone. And what I want to emphasize that I want to assure that this is being taken, making sure that all the pertinent measures are being in place in that region and in our region, and making sure that all the pieces are being carried on as per protocol. So investigation with that respect is carried out in a robust way.
Oh, I'm sure. I just wanted to really establish, and I think you've been able to confirm here that the virus doesn't care about the border of the municipal limits, city limits of the city of Edmonton, and so we've appreciated that the measures have come at the zone level. Regionally, we operate with a metropolitan mindset ourselves here in terms of the commuter shed, travel patterns, recreation patterns, all of these things that are borderless within our region, and the virus certainly is as well. So given that the scale of presentation right now and infection is the highest outside of Airdrie as a standalone within the Calgary region. As a region, ours is the highest in the province. What are the trigger points for stronger measures that you would look to bring in at the regional scale? What's the most important next trigger? This is the question I'm getting endlessly now. What will trigger stronger measures to reduce contact and reduce the spread? Is it transmission rates, positivity testing rates, which by the way haven't been reported for some time, or is it the hospitalization? What is the key driver of the next stage of restrictions should they become necessary?
That's a good question, but again, from an operational, because from an AHS perspective, we do work operationally. However, this triggers and determinants would be determined by our Alberta Health colleagues. So it's more of a policy question that pertains to what Alberta Health would plan with that respect.
Okay.
And at the moment, we haven't had information from Alberta Health about the triggers for the next action.
Well, I think the public wants to know, and so do we. So please pass that back. Thank you. I recognize you're in a tough spot, Dr. Zachary. Thank you for those answers. I'll go to Councillor Knack on the second round.
Thank you, Mr. Mayor, and not to press too much more on that question, appreciating that you're waiting on Alberta Health, but I do. So do they have that information, but they just haven't shared it more broadly with AHS, with the provincial elected representatives? I'm just trying to understand, is it that we don't know yet, that we actually don't have a series of measures somewhere, or they just haven't been publicly shared?
I will have to send this question with that information or with that question as well to our Alberta Health colleague. Okay. I have no information about this.
That's fine. I don't want to push it. Again, I appreciate. I just that's
so
such.
I would have to send this, provide specific answer, and then we'll circulate back to our City of Edmonton partners.
Thank you. Yeah, I really appreciate that, and didn't mean to put you in that spot, but I just similar to Mayor Iveson, that's the number one question that I'm hearing. So I was able to track down, based on the Alberta government website, back to the contact tracing piece, of all the active cases, about 76% currently show that they have an unknown original source, if I am reading this case correctly, or reading this chart correctly. So do you have any context as to what, let's assume you had the appropriate amount of contact tracing resources, which based off the other answers, it's not at the level we'd like to see it at yet. What would be the appropriate amount of time in order to determine where the original source came from? What's sort of the target timeline to sort that out?
So thanks for the question. So there are a couple of determinants that would determine the original source. Part of it, yes, would be the contact tracing piece, and the other is being able to sort out whether this is acquired at that setting or this setting. So, for example, and I don't want to go too lengthy, and I apologize, but I have to emphasize this. So, sure. If, for example, someone has been in different settings, so he is at home, but like at home there is no positive case, so probably he's not acquiring this at home. But what are the other settings that this individual has been in the past 14 days? It's sometimes pretty challenging out of the process itself, as I just mentioned, because the individual has to recall all the settings that he or she has been at during the past 14 days, which is pretty not easy process. Yeah. So at certain point, have you been in contact with the contact tracers? They do ask, have you been in contact with someone positive? So if they don't recall, and then going back to all the settings, trying to investigate, and then nothing is there, or no clue with that respect, or because of the information that has been provided to the contact tracers might not be entirely complete, and again, due to inherent nature of the process, this might be marked as an unknown.
Oh, I see. Okay. What are we doing differently than a spot like, and I want to give an example, and because I get asked this question, a spot like South Korea, which has a population more than 10 times the province of Alberta, and I think their deaths are lower than what Alberta has experienced. And I've heard that they had a fairly extensive contact tracing system built in right at the very beginning. So part of what I struggle with understanding, because I'm not a medical expert, and fortunately we have access to that, is that I'm not sure what the steps are that seem to be different from us 8 months into this versus a jurisdiction with a much larger population that has managed it in a different way. Do you have any insight into that?
Like steps, can you elaborate on that question, please?
I guess I'm just trying to figure out, so I've heard as an example, and this is one of many jurisdictions that has seen a fairly low death rate, but like South Korea has had, I think, lower total deaths with 10 times the population, or right around the same amount. And one of the major things they did was heavy focus on tracing, trying to track down to allow them to do more targeted measures to help inform what they would do and where. So I just don't know if we're aware of any differences. So is there something that other jurisdictions have done that have managed to keep cases and deaths to a minimum that we haven't yet been able to do for a variety of reasons, whether it's resourcing? Again, I'm not sure what those measures would be.
So, yeah, that's a very good question, and there are different determinants to determine the death rates or the total deaths. And part of this would be related to individuals themselves and how the virus would, what is the reaction of the virus, and having previous comorbidities. Age is a factor as well when it comes to prognosis of viral infection, and particularly with COVID. Other part would be, yes, tracing. The other part would be compliance to public health measures. So it's really challenging and difficult to say this measure is at this phenomena is attributed to that measure. specifically because there's a bundle of factors and a bundle of interventions that could work together, and it's really, really hard based on medical evidence to say, okay, this one works and this doesn't, or this one is this problem we have because of the contact tracing alone. It's a multitude of factors.
Appreciate that. I'm out of time. Thank you very much. I might have one more question, Mr. Mayor. Sorry.
Thank you. Councillor McKean.
Thank you very much. Adam, channeling the Rossdale Community League and their frustration out of having Camp Pekawaylan as a neighbor this summer and fall. Do we have plans, and can we say that there'll be measures to prevent Camp Pekawaylan from forming again in the spring?
So more holistically, Councillor McKean, it's the path that we've set related to pandemic shelter, to bridge housing, to permanent housing. One of the steps that we are considering is an order where executed by the city manager that would not permit any activity on said location. That's being reviewed by myself right now, and that would be a measure that would allow us some additional steps to remove in a quicker fashion. But I think the more practical approach is to do what we've been trying to do, and through council's advocacy, to get people on the right path for permanent solutions.
Yeah, I agree, and maybe working with the organizers around and letting them know what our strategies are and the investment being made in support of housing, that might help. But maybe offline, you and I could chat about that at some point, because I think I'd like to bring some assurance to the people of Rossdale. I think there's a little bit of neighborhood level PTSD down there, and I'd like to think that we could deal with that.
You bet. Happy to do that.
Thank you very much. I think the fire chief is on. I heard that our fire service is being dispatched to overdose calls every day. And I wondered if there was any data on that, on whether or not we're seeing more and more calls for service to overdoses.
Thank you, Councillor. We are seeing a continued trend in those calls. I don't have the data in front of me to show whether we're seeing a significant escalation there, but I can bring that back to you.
Thank you. And Adam, I was going to say, I wondered if there might be a few key data points like that that we might have come to us at our next EAC meeting. I don't know what exactly the best data points would be to get an indication of how the community is doing in and around mental health, and around mental health. I mean, even things like, I guess, calls for service on, Councillor Esslinger brought up earlier on domestic violence, such things as, I think we, looking at our homeless numbers, we probably have a fairly good indication there, and the numbers that are sliding into homelessness. But also maybe alcohol sales, maybe AGLC would be able to provide some general numbers. I don't know if AHS could provide some further numbers around overdoses and calls for service around mental health. I just think I feel a little bit blind to the physical and mental health of Edmonton and Edmontonians right now, and I just think it would be really helpful to get some data collected in a report to EAC. Is that asking too much, do you think?
I was just talking with Mr. Aiken, and I think we can develop a bit of a dashboard, both with the information that Councillor Esslinger has identified and some of this. for the next EAC, and also if we get it sooner, it could potentially be included in Mr. Aiken's weekly memo briefing to council. I would flag that, you know, we're full out in terms of the data means something. We won't be in a position yet to say, here's how we're responding to it, but at least we'll have an indicator in terms of where we're at.
No, it'll be difficult given our budget restraints too, but I just think it would be helpful to know. We're a little bit blind to what's going on out there, I think. So I'm out of time.
The other data point, Councillor, very, very briefly, is the opioid issue, and how that is showing you know, an increase on that metric. The cause and effect is not clear, but certainly that is that one data point is a growing concern for the community.
Yeah. Thank you.
Thank you. Councillor Walters.
Thank you. So Mr. Smythe, as we continue to support and work with the agencies around the shelters, I have a pretty significant worry about the high degree of burnout that we may, or these are agencies and their staff may experience through this winter. You know, I'll never forget my number of years working in the inner city and seeing the rates of burnout skyrocket during the winter around the holidays. And now we've kind of, you know, crammed all this stuff together into these very challenging shelter spaces. So I just wonder about a contingency plan or some preparation to prepare for that and respond to that. If it requires more funding, if it requires more staffing, just a comment on that.
Yeah, no, you're absolutely correct, Councillor. The agencies that have been contracted to provide the service at Convention Centre have been hiring a number of staff, and just getting those folks up to speed. The training that's required for those individuals is very significant.
Okay.
And so the whole sector is, as you say, is the stress level is not diminishing.
Right.
We talk about it. We certainly address it when I talk to CSS, the GO staff and the GOA, and with the agencies themselves, Homeward Trust, and others, in terms of what are some plan Bs if it does get to be overwhelming.
Okay.
So we're certainly aware, and it is a concern.
Thank you. And when we come back in December, maybe talk to us about that specifically in terms of how and what, and I would, speaking only for myself, invite you to ask us for more, because the costs on the other end of that are going to be far greater than if we have to provide some more resources, and whether we have to advocate for more resources through programs like MOST, et cetera. Mr. Laughlin or Mr. Aiken, I'm going to ask you this question rather than AHS. That, you know, Councillor Knack talked about this a little bit. It seems like those jurisdictions, whether it be Taiwan or South Korea or New Zealand or Australia, that have succeeded in really preparing for their second waves, have invested aggressively in contact tracing capacity. That seems to be the one consistent thread for sure in my research, as unmedical as it is. But while the virus is, you know, and the lack of that capacity while the virus is spreading leads to an increase in unknown community transition. So that data is less precise, meaning that it's more difficult to target restrictions, which means that if the total numbers continue to climb, a full lockdown is likely the answer. Correct. Is that a fair rationalization or understanding? That if we can't target, if the data is imprecise, our measures need to be precise, and we're going to be forced to a blanket approach. Like, is that a strong likelihood?
So I was going to sound like I'm hiding behind health, but I think the health authority needs to provide that direction. What I will say about those other areas is that, and whether it's data or whether it's anecdotal, personal accountability and following the measures is a lot more prevalent in those areas. I would suggest is a lot more prevalent in those areas.
Well, that's important, and I know contact tracing is not the only answer, and I think people are feeling tired and helpless, confused, but we have to be vigilant, and all we can continue to do in those areas is beg and plead and educate as much as possible. But I guess, in other words, if a government wants to keep the economy open and prevent a full lockdown and all the mental health ramifications and financial carnage resulting from that, hyper investment in contact tracing would be an important thing to do. In theory, is that a correct belief?
It's certainly, so the data challenges that we've articulated, and certainly in the region, they've articulated as well, getting a better understanding of how it's happening and where we can focus efforts of control will help for sure.
So whether our advocacy upward needs to be about that, I think is a question for us, Mr. Mayor, at some point, that any of these jurisdictions that have been successful there's been hyper aggressive contact tracing. So maybe just the last question for Dr. Zachary. Would you describe our contact tracing as hyper aggressive? It's kind of a yes or no question. I think you're on mute.
Okay, now I can. I'm on mute. So that depends on. It's hard to tell what is, because it depends on the definition. What is hyper aggressive?
Well, I guess there's the question that will remain at the end of this meeting today. But I think we have to continue to explore that. I'm out of time again. Thank you.
Thank you. Councillor Knack?
Thank you, Mr. Mayor. I guess actually just a question to you as the chair. There were a lot of great questions today without a lot of concrete answers, and through no fault of either admin or Dr. Zachary. Just to be very, very clear, that's information that I think I heard Dr. Zachary state that needs to be provided by Alberta Health. I'm a little uneasy about a 3-week time period between now and the next EAC, and especially not having answers to those questions and seeing the trend. I know we are very tight on schedules, but I'm curious if you have thought about that and if there's an opportunity to ask for a more immediate one that would hopefully be able to happen right after recess with the answers to the questions we've been asking.
Yeah, I'm amenable to that. I think we may need a touch point next week at the rate things are going. We can call that on very short notice, but ideally fixing it in our calendars might be helpful for planning purposes for everybody. But the virus is moving faster than we are right now, so 3 weeks is not going to work, I think. I quite agree. So, Mr. Laughlin, your thoughts on this?
November 27th is the date of the end of the restrictions, and so we'll have more, not the end of the restrictions, sorry, the timeline for the restrictions. So after the 27th, again, with hopefully the data, we'll be able to see if it's making an effect, and we'll be able to provide more information. So my suggestion is that we look at one of the committee meetings to see if the agendas are light enough that we could add in a half-a-day EAC meeting on the week of the 30th. I know executive committee is not light, but
yeah,
we could look at one of the other committee meetings as a potential half-day.
Yeah, I think it might make sense to look at the afternoon of the 27th too, in response to the latest information. I don't know if we'll have will the province be providing an update that afternoon, or do we have a sense of decision points or triggers? I don't want to lose 2 weekends.
So we asked that question of Dr. Henshaw. Unfortunately, she wasn't able to provide us whether she was able to give us any upfront information on new restrictions, a rolling of the current restrictions, or different ones before or after the 27th. So unfortunately, I don't have any additional information on that. I
think potentially grabbing up some committee time the following week might work, and we might want to do that anyway, looking at, and perhaps we can look at that at Agenda Review Committee on Tuesday. But I just want to float what kind of willingness folks would have to meet on Friday afternoon.
Yeah. So just to, with my remaining seconds, while of course I know it's recess and council's busy with a lot of things, with the lack of information that I got today, I would prefer not to wait beyond that point. So I'm more than willing to make something work on that day. And if we need a motion to that effect, I'll be willing to make it. And that's my time. I'll turn it back to you, Mr. Mayor.
Okay. Maybe just to test, are there any concerns or objections with us attempting to schedule something next week? I can call the meeting with the stroke of a pen, so we don't need a motion to do that. What we can do is go back and double check schedules with folks for mid-afternoon and see where we're at with the latest. No objections to that? Okay, I'm seeing some thumbs up from people. Okay, let's take the exact timing offline, because I've got a conflict in the early afternoon, but mid-afternoon, I think, might be a good time to check in on the 27th. And if we need something sooner, again, we can drop everything if the situation accelerates between now and then, but let's take the specific timing offline and work with our offices and attempt to connect next Friday afternoon. Okay. I guess maybe I'll ask a couple more questions. Oh, I see Councillor Nicol there. Go ahead. Councillor Nicol?
I just wanted to mention, because of a family member being in the hospital, I might not be able to attend.
Understood. Thanks for letting us know. I'm sorry to hear that. Maybe just a couple more questions. So, states of local emergency, and we had a good report on the legislation and some changes to the legislation as part of our kind of after action review a couple of months ago at Executive Committee. But just to loop back to that, I mean, the emergency powers seem to be primarily designed to deal with natural disasters and civil insurrection and other things like that. And they do have public health and pandemic components, but save a change that you can do a 90-day state for a pandemic condition rather than a weekly state renewal. The tools are not necessarily designed as public health tools. They can be used that way, but they're broad and enabling if you want them to be or if you need them to be. But I guess the starting premise of empowering local authorities to enact those states is primarily, in my read, about those other states of emergency and secondarily about pandemic, on the premise that the province has the much stronger tool set in the public health legislation. Is that fair? I mean, I think that was your analysis in the report.
That's correct. Short-term emergency situations, not prolonged, and again, not being the health authority, really challenging for us to make some of those decisions in absence of that expertise.
But we do have the tools, or we are enabled within mandate to issue orders under a state of local emergency to counter the spread of a pandemic. That's still a choice for us.
It is. The legislation change, just to caution, can be, my words, vetoed by the province.
So that's where I was going next, is because, I mean, I'm getting, and I think members of council and other mayors I've spoken to across the province and within our region are all getting questions about under what circumstances precisely could municipalities take the initiative. And we have some ability to do so. We have limited data to base decisions on. And the biggest challenge is the province introduced a mechanism to, your word is veto, is, essentially override measures, and a ministerial order can override an emergency management agency order anywhere in the province at any time, for any reason.
Correct.
Okay, and that's a new provision that was put in place in the spring as part of the legislative changes that came.
That is correct. And the one thing, just to sort of remind you that although we may not have a lot of those powers under the Emergency Management Act, we do still have a lot of administrative authority under just the Municipal Government Act and our normal sort of governance processes.
But we're allowed to make laws, policies, and enact procedures in furtherance of public health objectives. We have broad enabling authority that way.
Correct.
So Mr. Laughlin, you mentioned conversations with other cities in Alberta and with our regional neighbors. Would you agree with the premise that if it falls to municipalities to act, that based on my previous line of questioning about the borderless nature of the virus in a regional context, that would only really be effective and fair across an economy and a commuter shed and a region if the measures were fairly consistent across the different neighboring municipalities?
Yes, and in those conversations with regional partners, many are saying, how do we do this in a consistent way? So, but 100% agree. There is no wall around Edmonton.
Well, and this is where it would be most helpful for whatever measures that might get implemented to be implemented by the province using their stronger toolkit in a consistent fashion at a regional scale based on the evidence that they have access to that we don't. Is that a fair summary of
Yes.
the optimal answer?
Yes.
And the
very
suboptimal answer is we coordinate with as many neighbors as possible to bring in measures based on the best information and modeling assistance we could get from partners at the university, for example, if push came to shove.
Correct.
Okay. Well, that's plan A and plan B, folks. Okay. Any other questions? Not seeing any, then let's wrap it there with receipt of information on 3.1 and an undertaking that we will attempt to schedule a meeting later next week to check in on where all this is at. So need a motion to receive for information?
So moved.
Thank you, Councillor Knack. Anyone wishing to speak?
I will at some point quickly, Mr. Mayor.
Sure. Before I go to Councillor Knack to close, anyone else? No? Okay.
Sure.
Go ahead.
Yeah, sorry, I was trying
Go
to
ahead.
click on.
Go ahead, Councillor Walters.
So, when I do want to say to echo what you said at the start, Mr. Mayor, to our administration, to Adam and ELT and to Mr. Aiken, how grateful I am for your diligence, studiousness, commitment to doing this well and leading us through this well. This has been a hard year, and I think people are feeling exhausted and helpless and frustrated. And when I talk about my concerns about not being prepared, not being adequately prepared for a second wave, I don't attribute that to you. I think that you guys and our frontline services here at the City of Edmonton have done a remarkable job, and particularly to those folks organizing these shelter spaces to deal with an increased number of homeless Edmontonians every single month. This is very, very challenging, and I don't think we can underestimate how stressful this is for the people who are managing this stuff day to day. So my hearts go out to them for the difficulties that they're facing, and I salute them for that. I do have to say that, as an elected leader in this province, albeit at the municipal level, without a lot of seeming capacity to change things, notwithstanding what I hope, the hope I get from the mayor's latest comments. I do have some frustration with the lack of transparency around the data and the modeling and where we are and where we need to get to. I think we were doing a good job of that provincially at the beginning, and it seems to me like that's disappeared. I don't know, like we kind of have a sense of how bad things are, but I don't know exactly how bad things are going to get, and the various pathways that we can travel together as a community to avoid the worst case scenario. It's not being shown to us, and it's frustrating. And I think there's a lack of clarity about what the right measures are as a result of that lack of transparency about data. And there certainly is a lack of decisiveness. I think there's been way too much focus on philosophy here in Alberta, you know, the philosophy of personal responsibility versus the precise nature of public health recommendations. And we have to get into a place where we're far more decisive. So again, speaking as a municipal councillor, however we can help other orders of government become more decisive in the work that they're doing, we should try to do that. You know, I think we can be decisive where it's in our jurisdiction, and I would encourage us to be as decisive as possible and take the advice of our public health professionals. So as we head into next week's meeting, likely I think we need to think about that. How can we help our provincial leaders be more decisive? I don't know if that's possible, but it's worth considering. So I'll, you know, I guess receive this for information today, but as Councillor Knack said earlier, it's not a very satisfying conversation this morning. Thank you.
Thank you. Any other comments before Councillor Knack closes? Going once, going twice. Go ahead, Councillor Knack.
Thank you, Mr. Mayor, and I'll actually echo much of what Councillor Walters just said. Again, just quick, I'll again offer my thanks to everyone from City Admin. My frustration today is not at all from the city perspective. We are doing, and you are doing, your team is doing as great of a job as you can with the information that is being given. So similar to what Councillor Walter said, I cannot understand why why this information is not being made openly so that we can all work together, right? Everyone's been using the phrase, we're all in this together. Well, those are fairly meaningless words if we don't have the information and the data to come together as a collective group of governments, as administrations, as the public, to work through this. You know, pretty much what I've been seeing online is this back and forth to say, well, you know, we need to have personal freedom no matter what, or else you support an entire lockdown. Those are not the only two options on the spectrum. And yet it feels like with the lack of information that we have, it's feeling like we've only got those two choices before us. And that's really frustrating for me because I'm not a medical expert, obviously, and I would like to have data and information and analysis and measures that can help inform what we should be doing to help aid in the provincial work on a health issue like this. So again, likewise, it's why I didn't want to wait 3 more weeks because, you know, I've heard that maybe there are some measures that Alberta Health has that would help us better understand what actions we should or shouldn't be taking. Those should be out in the public. There should be no reason why we wouldn't be afraid to have that conversation. This is a serious issue. We all want to minimize the economic impact, the health impact, both in terms of physical and mental health. And so I think one of the best things we can do is be upfront. And I think, you know, I'll just speak for myself, but I feel like we are willing to help aid the provincial government in this because we all share those similar goals, but we can't do it without data. And so I just feel a little at loss right now. When I was out door knocking last weekend, this was the #1 issue to come up from people, and the common theme I heard from people from across the political spectrum was that they feel like they don't know enough. And I don't think that should be the case 8 months into this. I think some of the jurisdictions that have performed the best have been very open, upfront, and clear about the possible directions things can go, and then based off certain actions, that will help determine which direction you're headed in. So, sorry for my frustration. It's more of a general frustration that I just feel like I needed to say out loud based off what I heard today, what I rather haven't been seeing over the last little while. And so I hope next week we can get some more of those answers so that we can all help the province achieve their goals on this. So I'll obviously support the information, but there wasn't really much information. And again, no fault of Dr. Zachary, no fault of city administration today. That I'm not blaming anyone here who is on this meeting for that lack of information. I actually really appreciate everyone doing what they could with the information that we had to date. So thank you, Mr. Mayor.
Thank you. Please vote on receipt of information.
We have all the votes except for Councillor Cartmel's and your own, Mr. Mayor.
It's loading. There we go. The window closed, but you should have mine now.
I'm a yes, Denny. Thanks.
Display the vote, please. And that's carried unanimously. Okay, well, we will pick up aspects of this discussion tomorrow at Council's continuation on the face covering bylaw extension, and other aspects of this discussion we will pick up sometime next week, likely Friday afternoon. We'll work with your offices to schedule an EAC sooner than what's in the calendar. Thank you, everyone. Until then, we're adjourned.